Act with some reluctance. I would be prepared to support your amendment if you were prepared to accept a modest secondary amendment. And that is junk the Affordable Care Act and move forward to a Medicare for all single-payer system, which guarantees health care to all people as a right, and which, if it follows in the path of other countries, will substantially lower the per capita cost of health care in America, because we'll get rid of private insurance companies, we'll end up not paying the highest prices in the world for prescription drugs, we'll end the absurdity of all of the cost shifting that now takes place, we'll end up, as Senator Stabenow was saying, with the stupidity of having people going into an emergency room paying 10 times more than they do if they went to a community health center, but we're not adequately funding community health centers. So if we can agree on the principle that health care, as every other major country on earth does, that health care is a right, that the job of health care is not to make zillions of dollars for private insurance companies or drug companies, but to provide the best quality care in the most affordable way. Senator Wicker, you move for that? I'll co-sponsor your amendment. Modest amendment.
I will reserve the right to close, and I'll be happy to address that.
Let me just conclude. Obviously, I know you're not going to accept it. Look, the point is we have a dysfunctional health care system. 45,000 people die every single year because they're uninsured, they don't get to a doctor on time. The Affordable Care Act will help to some degree. We spend twice as much per person as do the people of any other country, and our health care outcomes are not as good because of the fact that our priorities are more on making money than on providing quality health care. So I think the Affordable Care Act is a step forward. I supported it. It does some good work in disease prevention. We've doubled the number of community health centers in the country. Does some good things. But I think we really have to think further. Guarantee health care for all people. Do it in a cost-effective way would be my goal.
I know Senator Kaine on our side is asked to speak. Are there any other senators? Senator Sessions? Did you want to speak?
Mine? Yeah. Well, I've opposed the act and thought it was unwise and believe that strongly, but as time has gone by, I've been more and more deeply concerned about this act. It's not going to work. It is going to cost trillions of dollars more than estimated. It's going to add to the unfunded liabilities of the United States almost, well, about half as much as Social Security's unfunded liabilities to the United States. It's going to diminish the quality of health care, and it's going to cost far more than people now estimate. Senator Sanders raises a good point, really. To me, it's sort of a halfway socialized, government-dominated medical system that's maybe the worst of all worlds. But it is my goal is not to see the government take over all health care in America. You go to countries around the world, they want to come here to get their health care. The examples are dramatic. Doctors, I'm really worried that we're going to lose top quality professionals who no longer want to go into medicine. And already there's, you've probably all heard it, sort of a depression in the medical field about their view of the future of health care. So I think this is a good amendment. I think it causes us now to begin to focus on this real challenge to our future. And I, for one, feel more strongly than ever we need to reverse this legislation, see if we can. And we can improve the delivery of health care, but not doing it in such a dramatic government-dominated fashion.
Senator Kaine?
Thank you, Madam Chair. I wish we would be talking here about reform and fixing, but instead we talk over and over and over and over again about repeal.